Hey everyone, welcome back to our channel. Today we are diving into the shocking reaction to the murder of United Healthcare CEO. Surprisingly, many people are expressing happiness over his death. We will explore why this is happening and underlying issue with United Healthcare and what it means to the healthcare industry, from the controversial policies to personal stories. We will uncover the reason behind this unexpected reaction. Stay tuned.
United Healthcare CEO Brian Thompson, who was fatally shot in Manhattan, is under scrutiny for his role in backing a controversial AI system, accused of denying 90% of patient claims. The insurer became the largest denier of insurance plans in 2023, dismissing 1 in every 3 claims. And it may have all been connected to HN Predict AI, linked to patient deaths and massive lawsuits, allegedly prioritizing profits over care. A lawsuit claimed the software led to the deaths of at least 2 men who were elderly patients denied post-care following a stroke and fall. Shell casings at the scene bore the words "deny, defend, and depose," pointing to alleged insurance tactics. Thompson's killer is still on the loose, as the NYPD believe the gunman may have fled New York City, with a water bottle dropped by the suspect being tested for DNA. However, Brian Thompson's death has sparked outrage over corporate healthcare practices and their impact on vulnerable patients.
If you ever start to think that you're irreplaceable at a job, never forget that Brian Thomas, the CEO of United Healthcare, was murdered on his way to a meeting, and the meeting still happened on time. And allegedly, they had his job posted before the day was even over. Now, to be fair, there's a lot of speculation that that last part's not true, and in all likelihood, it is hard to believe that they had his job posted before the day was over. But the meeting he was on his way to attend did still happen on time. And there's no way they didn't know about it. And by it, I mean the murder of the CEO right outside the front door of the building the meeting was taking place in. Like when HR was taking roll call for the meeting, these motherfuckers were like, looks like Jill's here, okay. Steven's here, okay. Andrew's on PTO, so he's gonna miss this one, all right. Brian was just murdered 20 minutes ago, so not going to be attending. I can also absolutely picture them being like, now everyone, this is just a courtesy reminder, but if you're going to be murdered before an important meeting, please make sure you're letting everyone know at least 2 hours in advance. All jokes aside, it doesn't matter what job you do or what industry you work in. Do not give all of yourself to a job. That job is not your family. That job is not your friend. And you could literally be murdered on your way to work, and the machine continues to move on without you.
So I took CEO out of my LinkedIn bio. No reason in particular. I didn't want nobody to get the wrong idea. You know what I'm saying? I heard that CEOs have 30 minutes, child. So mind you, the only employee I have is myself. But I didn't want no confusion, because after what happened the other day outside the hotel to United Healthcare CEO, that's crazy. But what's even crazier is right after that, I read a headline saying that another insurance company is gonna stop giving anesthesia for the full time, so they're only gonna cover it up to a certain time. And I'm confused, because I want to know, if you're the CEO of that company, you ain't see the news? No funny shit. You ain't see what happened to your colleague? You ain't see how within 30 minutes they had started the meeting on time, stepped over his body, had his emails forwarded, and had his job posted on LinkedIn within the hour? I don't know. Y'all might want to rethink that anesthesia thing.
Look, this is crazy. Look, United Health Group. We are deeply saddened and shocked at the passing of our dear friend and colleague, Brian Thompson, the CEO of United Healthcare. Brian was a highly respected colleague and friend to all who work with him. We are working closely with the New York Police Department and ask for your patience and understanding during this difficult time. Our hearts go out to Brian's family and all who were close to him. 41,000 ha-has. Only 2.2 thousand kind of sad crying faces. 42,000 ha-has? I'm sorry, prior authorization is required for thoughts and prayers. 15,000 likes. Sending prior authorization, denied claims, collections, and prayers to his family. 16,000 likes. Was his trip to the ER really emergent? According to his own company, my husband's heart attack wasn't actually an emergency, and we were out $3,000, full deductible. 5,000 likes. Is crazy what my first thought was. And then I look at the comments and realize I'm not alone in my thoughts. 1,000 likes. I just can't find the care. Maybe if they ask for pre-approval of my care, then after they care, their required deductible, I might be able to supplement some care. I can't even pretend to care. I hope he's looking up at us.
You can't tell me that this isn't a real villain origin story. Just look at that smile. This man went in with a silencer gun, shot the CEO of United Healthcare, and now he's missing in a thin air. The police are now offering $10,000 to anyone who happens to find him. One thing that the police did find was some bullet cases with some sketchy messages like deny, defend, and dispose engraved on these bullets. People have been trying to decode the meanings, but the closest one we've seen so far is that the insurers deny the claim, defend the lawsuit, and then dispose the patient. Later, a balloon with a smiley face and the message saying CEO down was found outside the Hilton Hotel, the exact location where this CEO was shot. There are reports after reports suggesting how United Healthcare was the top of some questionable claim denier. Since then, there has been a number of people coming forward to confess on how they were denied access to appropriate medical care. All of this has led to a notion going around on the internet as eat the rich.
New York City wants us to catch John Wick for $10,000. John Wick, bro's a professional. He woke up on time. He was laying in wait. He's a planner. He had Starbucks before this like it was a regular day, and then rode off on a city bike. He wasn't even worried, no getaway car or nothing. He said, I'ma just scroll on up out of here. Job's done for the day. He's a professional. He had plans and he executed them personally. If y'all think I want John Wick looking for me for $10,000, and I thought I seen something, but my vision ain't that good. My coverage ain't that good. So what I thought I saw, I probably didn't see, and what I see, I probably couldn't see. That's all I know.
The police trying to paint the killer of the healthcare CEO as like a common threat to the masses in an attempt to get people to turn him in is a hilarious strategy. Like, this was not a random attack. Everything was obviously planned, down to him engraving messages into the bullet casings. Unless you have 7 homes and like 2 yachts and a couple of mistresses, I feel like you're pretty safe from him. I don't think he's coming after me and my $20,000 of debt.
The people clutching their pearls over this instance with the United Healthcare CEO are really interesting to me because I'm frankly not surprised at all. And I think we're going to see a lot more of this coming. And the reason for that is I'm a very empathetic person, and I'm surrounded by people who I also consider to be very empathetic. Like, we see people being harmed on the news and we genuinely feel sad and want to help. And the general consensus is none of us have tears to shed over the CEO of United Healthcare because there's a lot of instances collectively of having been directly harmed and having our lives put at risk by United Healthcare. Specifically for me, I have type 1 narcolepsy, and in 2022, the medication that I need to keep transient paralysis caused by narcolepsy under control so that I don't fall and hit my head or neck and have the natural consequences of that, the medicine that I need for that, they kept denying. And I almost fell through a floor-to-ceiling glass window face first, and I almost hit the corner of a metal cabinet, like head first on like the part of your head where the outcomes from that are generally not good. And the only reason that didn't happen is that people around me football dove to catch me. And I told United Healthcare that this happened in the appeal to get my medication covered, and like rounds and rounds and rounds of appeals. They didn't care, and they knew that I was at risk of like unaliving or being permanently harmed, and like they didn't care. And the CEO was the CEO at that time. So like I honestly, like, checking in with myself, I'm like, I don't feel sad for this guy. I genuinely don't. I'm like, he probably got targeted by someone who was harmed by these policies. Like, that's probably why this happened. And like, honestly, it's sad, but I don't feel bad for him. And I'm a really empathetic person who's not ever looking to harm anybody. There's a lot of people in the society less empathetic than me. So like, if we don't see things changing soon, I don't think this is going to be the last time this happens. And like, frankly, like the pearl clutching, I don't think it's quite helpful.
You know why I don't care? That the CEO of United Healthcare was also a husband and father. My mom died from complications due to diabetes. Diabetes requires a lot of supply. Not just things like pumps, insulin, needles, test strips. It's things like batteries, alcohol wipes, Band-Aids, tape, gauze. 6 months before my mom died, her health insurance let her know that all of the things that she had been prescribed and insured for the last 10, 15 years of her life were no longer going to be covered. The insulin her life depended on, the pumps her life depended on, and the batteries that go in those pumps. The morning after my mom died, and I'm talking not even 24 hours after, 7 a.m. the morning after my mom died, a box full of all of my mom's supplies for the next 4-6 months showed up on my front step. And inside the box, with all of her supplies, there was a letter that said, "Due to the change in your current situation, we have now fully insured and covered your supplies." The current change in situation was listed as death. Patient expiration. So yeah, it makes sense that all of the health insurance companies in the United States have now taken their CEOs off their websites, because it's not a matter of if this happens next, it's when.
I saw the United Healthcare CEO was taken out, and I was going to give my condolences, but then I remembered that my mom and dad's chemotherapy alone is $50,000 a month. So my condolences are out of service.
I've worked for the insurance industry for over 6 years now, and I saw the United Healthcare CEO was fatally shot and killed. And honestly, I think that should hopefully just bring some sort of awareness for just the level of corruption that is going on in our world. It is insane with the level of denying of claims, and it's wrongful denying. I work for insurance, American Family Insurance, Costco Connect Insurance, and several other operating companies. But yeah, they got these short-term and long-term disability companies. If like employees ever even need to use their benefits, Sedgwick and MetLife, pretty similar to United Healthcare, they actually all kind of work together in some sort of ways, in my opinion. But yeah, if you're ever in a short-term disability claim, you're gonna get constantly asked for 30-day updates. If your doctor appointments are out of that 30-day range, they'll probably make you have to go through an appeal. I had to go through 3 different appeals with them and had to get like forms to them continuously, delaying my paychecks. And then long-term disability actually means your employer is gonna fire you and you're gonna lose your health insurance and your dental and your life insurance and all those good benefits. You're gonna be expected to go on COBRA insurance. But the funniest thing of all, for me, I had to go through a short-term disability claim. They made me a floating employee like 4.5 months in. You're supposed to get 6 months worth of short-term disability benefits, but companies will put you in a weird situation, make you a floating employee, and they'll ask you for return to work paperwork, and then they'll see if there's any jobs that are potentially available for you to fill at that time. But if there isn't, that's gonna result in you getting fired as well too. So it's almost like a lose-lose situation if you work for those companies, at least in my case. So yeah, everyone, we just live in a corrupt world. If you ever gotta use your long-term disability, don't, because you're gonna have to get on Social Security and your employer is gonna fire you. On top of it, horrible company for American Family and Costco. I worked for them for 6 years, applied for my old job. They had 45 openings and declined me. So yeah, just a horrible company.
You are telling me that Brian Thompson, the CEO of United Healthcare, was making $10.2 million a year, and they're offering us $10,000 to find his killer? They don't want us to find him. The goal is not to find him. Okay, thank you.
I'm going to find it very hard to believe that the CEO of United Healthcare, that what happened to him was just a random act of violence from someone upset at some type of insurance. I'm going to find that real hard to believe. Before that storyline even start, I'm going to find that real hard to believe. There is no way that an individual, without this being an inside type of situation, can know that somebody has a meeting at 6:45 in the morning, where the meeting is and what door this individual is coming out of. Those are too many. See, y'all playing with a major investigation. I investigate everything to the T, what time was it? 6:48. How many seconds before it got to 6:49? I'm that person. I'm sorry, the time was 6:46 a.m. He was arriving early for a conference, and they're saying that the shooter left out on a bicycle. This shooter was bold. You left out on a bike. Are y'all catching what I'm putting down? This took place in Midtown Manhattan at a Hilton hotel. Now, there's so much more. They're still looking for this suspect. For me, this is deeper, and that's why I tell y'all, when we talk about people in the upper echelons, the biggie wiggies, the elect, there are evils of this world that is just completely unknown to us. Because I'm starting to think about Chandra Rhimes. Catch it. Starting to don't sit right in my spirit. At a time like this, the inauguration coming up, there are things, governmental programs that are in place. I believe that Obamacare was up under, it's a private funding for underprivileged people, in which this company, United Healthcare, had a government contract with. Not only that, there are things happening with government programs as it relates to the food share program. Have y'all been following that story? I think somebody said that you won't be able to get it only for 3 times a month or something weird like that. I don't know. I haven't been following it all the way, but the stuff that I've been understanding, I'm like, well, this is very odd and interesting. It's a lot of unknown things in this world with principalities that we do not understand, and we may not know, and we may not ever know. Catch it. I know one thing's for sure. That was too organized. That was an organized crime for me. That was too organized for you to be. But then some people, witnesses, said that the person had waited out there. First of all, how you know what time this man is leaving? Unless you decide to wait, you go wait all day until he left. Yeah, I don't know if that. How you know what door? That just is too coincidental for me. And coincidences don't happen. It's very professional to me. Catch it. Prayers go out to the family. This is mind-boggling. There's things happening in our world that has never happened. I mean, we looking at 2025 like, are we sure? Prayers goes out to Brian Thompson's family, that is the CEO of United Healthcare, and with what happens. And I pray that you guys will for real get justice. And when I say for real, I mean for real, all the way to who told this shooter to do this? Catch it. My prayers go out to y'all.
We pay $1,000 a month for a healthcare policy that has a $10,000 deductible. My empathy only extends so far. We've been trying to tell you that for-profit healthcare kills. Y'all just haven't been paying attention because it only kills poor people. Until now. Nobody deserves to get on their way to work. Nobody deserves to get their healthcare claims denied either. Be mindful of how this story is covered. Be mindful of how people are expecting us to have empathy for a man that's worth $40 million, is the head of a company that made $6 billion in profit. And the reason they made $6 billion in profit is because they deny 30% of their fucking healthcare claims. They want us to have more empathy for this man than they want us to have for the people that are killed because of his company and because of how his company operates. And you know what? We're privileged. We're lucky. We're healthy. I couldn't even imagine having a family, having kids, having a chronic health condition. For-profit healthcare kills. We've been trying to tell y'all. The way insurance companies treat patients and the way insurance companies treat doctors is criminal. They are liable for way more deaths than a single gunman. Never, ever, ever forget that.
I've never seen Americans as united as they have been since the CEO got French Revolutioned. This is truly a defining moment for class consciousness and solidarity across the entire political spectrum, the urban-rural divide, all genders, all races. Everyone has been united and coming together to celebrate this CEO being French Revolutioned and the implications of what it can mean to standing up to corporate power. If we effectively harness this energy, this could actually be a real catalyst for revolutionary change. Everyone's responses, including Republicans, clearly and unanimously identifies who the real enemy is and who is responsible for making all of our lives miserable and insufferable, and why we are all so angry and fed up with the system that we are subjected to. Everyone is angry, and the only reason why Donald Trump has had any success is because he is manipulating, abusing, and using people's anger and misdirecting it towards the wrong source and the wrong people to deflect from him and his people actually being the ones responsible. And the Democrats are solely to blame for this because they are just gaslighting people, telling them that they shouldn't be angry, that they should accept business as usual, that their lives aren't actually that terrible, and they just need to get over it. They're not offering any broader vision of how to make anyone's lives actually better. And so when you neglect and dismiss people's anger, they're going to channel it and direct it at someone. And if someone is telling them who to be angry at, they will be angry at that group. The rich use the culture wars, race, gender, religion, nationality to create an illusion of division amongst all of us so that we fight each other and are angry at each other and blaming each other for why we're all so goddamn angry and miserable, rather than directing our anger and our organized power against them, because they are literally the 1% and we are 99%. We have way more in common with each other than what we could possibly ever have with them, and they know that. And that CEO, being French Revolution, just naturally and circumstantially revealed the source, the real source of people's anger and misery, and that it's actually not because of immigrants or homeless people or Muslims, that people actually do intuitively know who is responsible for exploiting and extracting from them. We need to use this moment where everyone across the political spectrum is having this clarity of the source of their pain, suffering, and anger, so that we can collectively and effectively organize our power around that anger and redirect it to the people and the systems that are actually responsible for all that suffering. This is the moment that we have been waiting for. Decades of political education and book clubs aren't going to provide the class consciousness that has happened over the past 2 days. And so we need to integrate this into our strategy for creating a broad-based movement of liberation.
I think we all needed some good news today. Obviously, I would never publicly condone violence of any kind, but I don't think anyone should feel bad about this. The entire business model of private health insurance companies, especially United Healthcare, is to prey on the most vulnerable people in society, to deny life-saving medication, life-saving treatment, all to boost their own salaries and appease their shareholders. It is companies like this and people like this guy that are the reason why healthcare is so insanely unaffordable in this country. 45% of Americans struggle to pay their medical bills. And then you have this guy making $10 million a year to basically just rob people of treatment. The assassin got away. He escaped on an e-bike, so he literally could have been anyone. He could have just been somebody whose family member or loved one was passed away because they were denied life-saving treatment. Or he could have just been someone who's fed up with late-stage capitalism and America turning into a kleptocracy. Like, the wealth disparity in this country is getting so insanely ridiculous, and we don't want the ultra-wealthy running the show at the expense of working class people. I mean, like, 8 of Trump's cabinet picks are billionaires that are out of touch. Meanwhile, normal people can't afford medical bills and are being denied insurance.
I'm not gonna lie. What happened to the CEO of United Healthcare was definitely chilling and sad, so heart goes out to his family. But whoever did that, it had to have been personal. No one can convince me. Because the note that was left, you can't convince me that person was denied some type of insurance claim that he needed. Either his daughter was sick, his mama was sick, his wife was sick, he was sick. He needed something. He needed a surgery. He needed something, medication, and United Healthcare won't doing it. And he realized that it's either one way or no way. And he chose to do that way. Granted, was it the smart way? No. But you have to understand, living in a country like this, where the rent is $5,000, you owe this money, everybody's in your pocket. I'm not surprised that he chose to do the irrational thing. He or she, whoever this mysterious person is, like, this person must have been in complete stress, because this person even left a note, like, at the scene, like, because they were very angry. They even said, like, he waited there for him to, like, walk out. Like, he even knew what door he was going to come out of. That's how I knew, like, this was something that he planned. This was some type of anger that he had pent up. Whoever that he had, or whatever happened, the person that needed the insurance claim must have no longer been on living. Because that's the only way I can assume, or that's the only way I can think that someone would do something so violent, if that makes sense. Although this is something that's super duper tragic, hopefully this opens up the eyes of all the insurance companies out there to start taking their customers seriously, so things like this do not happen in the future. But thoughts and deductibles.
Oh, nah, I ain't seen nothing. I ain't seen nothing. Matter of fact, I'm blind in my left eye and 43% blind in my right eye. I don't see much of nothing. Matter of fact, I can't even see you, sir.
I just heard that the CEO of United Healthcare was gunned down in New York City. Now, as CEO of United Healthcare, he's the one that's in charge of all those panels that sit around and creatively decide how they can deny you coverage for that health insurance. You know, things like, oh yeah, even though you went to the hospital that was covered, unfortunately the doctor that saw you during that emergency, he wasn't covered. So you can either decide to pay out of pocket and put your family and yourself into bankruptcy, or die. He's in charge of those panels, and it must be exhausting because last year he gave himself just over a 12% raise to $23.5 million a year. What exhausting work. NYPD put up a tip line in case anybody knows anything. Now, I don't know too much about New York. I've only been there once. Nice place, too cold for me. But I feel like I know just a smidge about New Yorkers, and I bet their phones don't work this week. They can probably get calls, they probably just can't make them. In other news, NYPD said during the press conference the tree lighting will go on. So, you know, thoughts and stares.
Thank you for joining us on this deep dive into the shocking reactions to the United Healthcare CEO mother. It's clear that this story has struck a chord with many, revealing a deep-seated frustration and feelings about the healthcare system. As we reflect on these events, let's remember the importance of empathy and understanding in the times of controversy. If you found this video insightful, don't forget to like, share, and subscribe for more thought-provoking content. Stay informed, stay engaged, and we'll see you in the next video.